So third degree heart block or third degree AV block, what is that? A third degree AV block or heart block, there is no connection between the atria and the ventricle. So for whatever reason, whatever's happening in the atria is not getting through and going to the ventricle. There is a total disconnect. So the P's march, so P wave to P wave march is regular. The QRS's march, so they're regular. R to R, Q to Q, they're regular. The P's are regular, the QRS's are regular. The QRS's can be wide. In second degree block, they can be narrow or wide, but they're generally a little to the wide side, but that's not all the time. Just be looking for the missing QRSs. And so back to third degree, the QRSs can be really wide, and there's absolutely no relationship between the P's and the QRSs. So what that means is the ventricles are having their own rate and the atria is beating at its normal rate. Let's see if I can hang that right there like that. Bring it in a little closer. So if you look, the P's all march out. P to P. They're coming in right where they're supposed to. There's one coming in there, one coming in there. And they come in perfectly aligned. And the QRSs come in where they're supposed to. But this P here, way out here, is not producing this QRS, nor is this P that's basically on top of the QRS. Again, look at that, it's right on top of it. So that's not making that QRS contraction. So the P's and the QRS's have nothing to do with each other. They're totally beating independently of each other. So that is a third degree block. Now, a third degree block is also called a complete heart block or complete AV block. They have several names for it. It all depends where you work, who you talk to. So this one's a little bit harder to see, but if you look, there's a P, there's a P, there's a P, and they're just kind of hidden in there. And I think this is one that is even a little better. So a P, a P, a P, and the QRSs, they're narrow, but they march out. But they have nothing to do with making, these P waves are not making those QRSs. So that's a complete heart block. Complete heart block needs a pacemaker. So what the treatment is, when a patient has complete heart block, they need to get rid of all their cardiac medications that they have on board. So meaning if they're taking heart medications, they'll need to stop the heart medications while they're in the hospital, and we'll keep them monitored. And once they have gotten rid of all their heart medications, they've worn out, if they're still in third degree heart block, they qualify for a pacemaker. And or if they are having 5-second pauses, and we all know that 5-second pauses are a very long time not to have a QRS. So it would be a straight line for 5 seconds. Then the patient's going to get a permanent pacer. If not, then Sometimes third-degree block will resolve when the medications uh, clear via the urinary tract system. So Medicare doesn't allow us just to put a pacemaker in. Pacemakers are really expensive. They cost about $70,000 to $80,000 depending. That's for the actual pacemaker, having the surgery, going to the OR, having anesthesia, all that. And so it does cost a lot of money, so they don't want us to just put pacemakers in people to put them in. Now, in the event somebody comes in third-degree heart block and they're very symptomatic, meaning they are not feeling well, their blood pressure's really low, they can't get their heart rate up because of their heart block, and they're dizzy and they're passing out or near passing out, then we can put a temporary pacemaker in them, or we can pace them through the skin. And pacing through the skin really hurts. That's mostly done in an emergency situation because it is very uncomfortable. The patient gets electrical shock through their skin to go to stimulate their heart. So a temporary pacemaker they put in through um, it's almost like a IV in the arm, and then it's a little machine that hangs on an IV pole next to the patient, and the electrical impulse is given directly into the heart, not through the skin.